Hey everybody, this is Dr. Paul Thomas with Plum Health DPC here in Detroit, Michigan, and today we're going to do a coronavirus update. It is Friday, March 5th, 2021, and we have some good and bad news. So we're going to do like a little sandwich, good news, followed by some bad news, and then some more good news. So to start, there's only been one child flu death this entire season. So only one child has died. In comparison, usually around 150 to 200 children die each year of the flu. And one of the reasons that that's happened is because everyone is wearing a mask, physically distancing, and of course, most schools are not in session right now. And so, on the bright side, we know that these masking efforts and physical distancing efforts do have an effect. They've completely almost eliminated flu deaths this season among children. So that's kind of a good note. Another good note is that we're seeing a dramatic reduction in the number of daily cases. So here in Michigan, we're seeing about 1,400 new cases each day. And that's a dramatic improvement from around November, December, the holidays when people were gathering and the virus was really spreading in that critical time in the winter. And now we've seen that come down significantly. And you might be able to attribute that to the vaccines. And we've definitely seen a lot of people getting the vaccines, which we'll get into. This is from the state database. You're seeing similar data. You're seeing about 9,000 new cases a day in that late November, early December period. And now we're getting down to like 1,500, 1,400 cases each day. So significant improvement in the number of new cases each day here in the state of Michigan. Statewide, we've had 590,000 confirmed cases, and unfortunately, we've had 15,600 deaths. If you compare that to the size of some major cities in our communities, 15,600 deaths is greater than the entire population of Traverse City. It's greater than the entire population of Grosse Pointe Woods and Fenton, and we're getting close to numbers of Huron Township, Mount Clemens, Hazel Park, etc. Milford, it's a lot of people who have died due to the coronavirus in the state of Michigan. I did want to highlight that. I didn't want to dwell on it too much, but it needs to be said just to put this into perspective. So on the bright side, we're having more and more vaccine doses given here in the state of Michigan. In the state of Michigan, we've had 2.4 million doses given, which is about 25% of our entire population. There's about 10 million Michigan residents. Only 890,000 people are fully vaccinated though, so about 8.9% of the population is fully vaccinated. And that's pretty good if you're looking nationally, just in terms of the number of vaccines given, 2.4 million vaccines given, that's 9th nationwide. But we have a really good percentage of people that have been fully vaccinated. So, we're doing better than a lot of states in terms of the percentage of people in Michigan getting the vaccine. So that's really positive and inspiring. So thank you very much for getting the vaccine, protecting yourselves, protecting your loved ones, and most importantly, the vulnerable people who live in our communities, like our family members and friends who are in nursing homes or group home settings, etc. So let's talk about the coronavirus vaccine and how it works. As we all know, this is the coronavirus itself. This is the entire coronavirus, the entire virus. And on the surface, you're seeing these red dots, which are the spike protein. And so one of the pathways to develop a vaccine is taking one of those spike proteins, creating the genetic code or the mRNA that creates that spike protein, and then allowing our immune system to develop antibodies to that. So that's what we're doing with two of the vaccines, the Pfizer vaccine and the Moderna vaccine. The other way to do this is to use an adenovirus or package the mRNA inside a viral particle and then allow the body to create these spike proteins and create an immune response. So I wanted to walk through this because a lot of people are concerned. They're scared about what this is. Does this alter my DNA or anything like that? So we're going to walk through it. So the RNA is packaged inside basically a fat globule. it's like lipid. So it's like a droplet of fat, and within that is this RNA. And, it has to be kept at a really cold temperature so that it doesn't break down. It's injected into your arm, and then it goes into your cell, but not into the nucleus where the DNA is. It goes into your cell, and you use your cell to create these spike proteins. The spike proteins are made, and then you create antibodies which protect you from when the real virus enters your body. So if you were to see the real virus, your body would be primed with all of these antibodies from your T cells to go in and attack the coronavirus. That's why this vaccine is so effective. You're basically priming the pump, or I kind of liken it to like a most wanted poster. Your body is showing itself like a most wanted poster. It's posting it up in town so that when the coronavirus walks in, everybody's ready, guns drawn to take out the coronavirus. Okay, so there's a big myth that people seem to think that the vaccine will alter my DNA and therefore I do not want to take it. And that's not true. There's a very low risk of that happening. What happens is that mRNA virus gets into the cellular apparatus, but not the nucleus. It uses different proteins called ribosomes to make the spike proteins, and then your body develops that immune response. Okay, so it doesn't necessarily go into the nucleus and alter your DNA. So one of the reasons that scientists really like this mRNA vaccine is it's easier and safer to produce. Remember, with like vaccines like the flu, you have to use egg protein. You have to basically make the vaccine in eggs, so people have egg allergies. It creates more allergic reactions. This is a safer vaccine. No contamination. So like sometimes you can have salmonella grow in eggs, and that could contaminate certain vaccines for let's say the flu. But with this, there's a low risk of that happening. So there's a low risk of integrating into the genome. Rapid response for emerging pandemics. We really just need to tweak that mRNA to create the spike protein that we want, and there's lower production costs. So all of these reasons make this mRNA vaccine a good vaccine. So a lot of people want to know, when will I get my vaccine? Like I mentioned before, I wrote a blog post about this, but it's gone out to healthcare workers, and it's gone out to a lot of our long-term care facility residents, like nursing homes and group homes, etc. And we're getting through these 75-year-olds, and we're getting through the 60-year-olds. And in Detroit now, if you're 55 with a pre-existing condition, you're now eligible. I think they dropped it down recently to 50. I think that's in our coming up slides. If you're a restaurant worker in Detroit, you're eligible. If you're in K through 12 education, you're eligible. There are so many people now that are eligible, especially in the city of Detroit. A lot of people are getting it through the MyChart of the like Henry Fords and the Beaumonts of the world. And I also know some people are getting it through the Rite Aids and Walgreens of the world, so the big box pharmacies. So there are a lot of different ways to get the vaccine right now. So let's focus on Detroit, because our practice is in Detroit. A lot of our patients are Detroit residents. So any City of Detroit resident who is 50 years old or older, so if you're born before 1970 with a chronic condition, you're now eligible. If you work in a manufacturing sector, you're eligible. If you're a good neighbor and you're 55 and you drive a Detroit resident to get the vaccine, you're eligible. So we got this, Detroit. Let's keep going down to the TCF Center, keep getting the vaccine. Any resident who is 60 years or older without any pre-existing condition, you're now eligible. Like I said before, K-12, adult foster caregivers, U.S. Post Office employees of the city of Detroit, anybody who's in the law enforcement community, they can go down to the TCF Center. And then there's still more people who are eligible. All food and bev workers. We take care of a lot of patients who are in the food service industry. So you are all eligible. Security guards and janitors, active members of the clergy. I saw a great video of a clergyman talking about, bearing witness to this vaccine, and just saying, in the church we say that we bear witness. I got my shot, and so I recommend it to all of my congregation. And so Funeral home and mortuary service employees are eligible as well. Thought I'd throw in a nice photograph of Mayor Duggan getting the vaccine, masked up. So if you want to get the vaccine, call 313-230-0505. Great, easy way to get the vaccine at the TCF Center. If you live in Wayne County, call the Wayne County Health Department. If you live in Oakland County, navigate to the Oakland County vaccine website or call the Oakland County Health Department. There's a lot of different resources, different ways to get the vaccine. Let's do a little compare and contrast. For the Pfizer vaccine and Moderna vaccine, you need 2 shots. The Pfizer is 3 weeks apart. The Moderna is 4 weeks apart. For the Johnson & Johnson or Janssen Pharmaceuticals vaccine, it's a little confusing, but there's some ownership there. It's only 1 vaccine dose. So they all prevent hospitalization and death. The Pfizer and Moderna are about 95% effective. The Johnson & Johnson vaccine is about 85% effective. The Pfizer vaccine is effective 7 days after the second dose, so about a month after the first dose. The Moderna vaccine is fully effective 14 days after that second dose. And the Johnson & Johnson vaccine is fully effective 28 days after the initial dose. The Pfizer and Moderna are both mRNA. The Johnson & Johnson is an adenovirus vector. We're not really sure how long immunity lasts. That remains to be seen. Hopefully months to years or forever would be ideal, but the science is still out on how long that effectiveness will last. Okay, so some notes on the Johnson & Johnson vaccine because it is so new. Michigan just received 82,000 doses, and they're trying to distribute it to places where not a lot of people have gotten the vaccine, which is smart. So in the preliminary analysis, Johnson & Johnson vaccine demonstrate an overall efficacy of 72%. It's 85% in preventing severe disease and 100% effective in reducing hospitalization. So all of those things are good to know. So the Johnson & Johnson vaccine, because it's only 1 dose is needed, the state of Michigan is recommending that people who are homeless get the vaccine, college students, migrant workers, people who have substance abuse issues, or people running sexually transmitted disease clinics. Sometimes it's recommended for manufacturing sector and food service sector, and they're recommending it hospital discharge and for people who are homebound. Obviously, if you're homebound, it's easier just to take out 1 dose. And plus, there's greater stability. It doesn't need to have that really cold temperature like the Pfizer and Moderna vaccine. So let's just do a little throwback, Flashback Friday, I should say. Elvis helped America eliminate polio. He went on the Ed Sullivan Show back in, I believe it was October 1956, and got the polio vaccine live on camera. And we're seeing that again today. We're seeing that with celebrities who are now getting the vaccine today. So it's nice to see people like Dolly Parton getting the vaccine and singing vaccine, vaccine. If you haven't seen that video, it's pretty funny. It's on Twitter. She tweeted out 5 million views on that one. And so go check that out. And if you have any questions, you can reach out to me, paul@plumhealthdpc.com. That's my email address. Or you can call our office, 313-444-5630. I'm sincerely happy to help people in our community navigate through this coronavirus pandemic. And I'm happy to clarify any questions you might have about the coronavirus vaccines that are now out there. So stay safe, everybody. Wear a mask and keep everyone around you safe by getting the vaccine. Take care. Have a great weekend.